Prevent transmission of TB, produced in public interest by Dr. Sumana and Mrs. Navanitham. 4 lakh Indians are dying of TB every year. Preventing transmission of TB is far more important than curing TB. Preventing transmission of TB is also far more easier than curing TB. By sneezing, coughing and spitting carefully, we can prevent the spread of TB. Practice these habits yourself and ask others to do so. Mothers at homes and teachers at schools have to teach children how to sneeze, cough and spit. This is my grandson. He is just 11 months old. My daughter has already taught him how to cough. He is coughing with his hand covering his mouth. Mothers, please teach your children these important things. Even before they attend schools, children should know how to cough with their hands covering their mouths. These are nursery class children of a school in Medak district. We took them up to the terrace and taught them how to cough carefully into their elbows. Some learned it and others were not prepared to. I am sure that their class teacher would be able to, within a week, teach all her wards how to carefully cough or sneeze into their elbows. We next called up first standard kids to the terrace and asked them to show us how they cough. All the children seemed to be happy perhaps to be out of class. Many children showed how they cough. They were all coughing with their mouths uncovered. We next asked them to show us how they sneeze. They were sneezing also with their mouths uncovered. We then asked the class teacher to teach the kids how to cough and sneeze into their elbows. In a very short time, the children were learning how to cough and sneeze into their elbows. The kids were instructed to always cough or sneeze into their elbows and also instruct other members of society to do so. This little girl has not only learned her lesson, but she is teaching others too. And this lady has learned the lesson. After coughing and sneezing, the third important factor that contributes to the spread of TB is spitting. Chewing and spitting of pan and tobacco products on the roads is very common in India. Coughing and spitting on the roads is also very common. Under suitable circumstances, the sputum of a tuberculosis patient can be infectious to others for nearly 6 months. Chiefly on account of careless coughing, sneezing and spitting, nearly 40% of Indians are already having latent TB infection. 20 lakh Indians are developing TB disease and 4 lakh Indians are dying of TB every year. 125 years ago, TB was very common in Europe. 5,000 Europeans were developing the disease every day. Most of them died within 5 years of getting TB. The cause of the disease was not known and there were no drugs for it. Doctors merely advised patients to have good food, fresh air and sunshine. When Robert Koch discovered the TB bacillus in 1882, it was understood that TB was an airborne infectious disease spread by careless sneezing, coughing and spitting. Massive public awareness campaigns were conducted and the people readily adopted careful measures of sneezing, coughing and spitting. Within a few years, dramatic results were seen. Only 500 people were developing TB every day. By just adopting preventive measures, long before TB drugs were even discovered, Europeans successfully reduced the TB problem by 90%. India presently has a similar problem that Europe had 125 years ago. 5,000 Indians are developing TB disease every day. Inspired by the European success, should not we begin to fight back against the killer disease by paying attention to preventive measures? When a baby can be taught how to cough with a hand covering the mouth, when kids can be easily taught coughing and sneezing into their elbows, when an entire continent, Europe, could change its habits of coughing, sneezing and spitting and thereby obtain a victory over this killer disease, India, will you not wake up? India, will you not rise up and fight the enemy that is killing you? India, will you not crush and defeat the enemy as Europe had done 125 years ago? India, are you prepared to make the sacrifice required to ensure that we and our children are free from TB? India, prevent the transmission of TB, and very soon you'll be free from it.